Navigating the process of getting a COVID vaccine today is proving to be quite a challenge for many individuals. If you've tried to get this year's booster shot, you might have felt a sense of frustration. The reality is that the Food and Drug Administration, FDA, has changed its approach. Unlike previous years, where anyone aged 6 months and older could receive the vaccine, approval for this year's shots is now limited to specific groups. Those aged 65 and above, as well as individuals at higher risk for severe illness due to the virus. This marks a significant shift in vaccine accessibility. Some health officials from the Trump administration assert that younger individuals who are generally healthy possess sufficient immunity, making annual booster shots less critical for them. However, many professionals within the medical community argue otherwise. Numerous doctors' organizations contend that getting vaccinated is still a wise choice to help prevent severe illness and mitigate the spread of the virus to those who are particularly vulnerable. So, how does this new policy affect you? If you found it easy to simply walk into a pharmacy for a shot in previous years, you might now find yourself turned away unless you fit into one of the approved categories. Here's what you need to know about getting vaccinated right now. Question: if a pharmacist determines that I'm not eligible, what options do I have? A. You may have some recourse. If you have any of the identified risk factors, you could potentially self-attest your eligibility. This means that you could simply inform the pharmacist about your risk factor or mention it when scheduling an appointment for a shot. Generally, you won't need any formal documentation to do this. At this moment, some pharmacies might ask you to obtain a prescription from your doctor to get vaccinated. But this requirement could change once the Centers for Disease Control and Prevention, CDC, provides clearer guidance on vaccination recommendations. The CDC Advisory Committee is set to convene on September 18 to 19, and their decisions could reshape the current landscape. How can I determine if I'm at risk? What conditions are considered? A. Dancer. The CDC provides a list of risk factors for the public here, which will be an EM Prime and the public end of content. That's in the URL, range and form. Individuals who are 65 and older, those from racial or ethnic minority groups, and people with disabilities are included among the high-risk categories. The criteria extend to a range of additional health conditions, such as asthma, cancer, cerebrovascular disease, chronic kidney disease, chronic lung disease, chronic liver disease, cystic fibrosis, diabetes, both types, disabilities, heart conditions, HIV, mental health disorders including depression, neurological conditions like dementia and Parkinson's disease, obesity, inactivity, primary immunodeficiencies, smoking, even if you have quit, organ or stem cell transplants, tuberculosis, use of immunosuppressive medications like corticosteroids. The FDA estimates that between 100 million and 200 million Americans could qualify under these new criteria. What if I'm expecting a baby? A. Pregnancy is also noted as a risk factor. However, there's some confusion since the CDC has recently dropped the regular vaccination recommendation for pregnant women. This inconsistency raises questions about vaccines being administered to pregnant individuals and whether insurance will cover their costs. Nevertheless, the American College of Obstetricians and Gynecologists still recommends that pregnant women receive the shot to help protect both the mother and baby. Are children allowed to get vaccinated? A. Children can indeed receive the COVID vaccine. However, this year's eligibility is limited to those at risk for severe complications. Moreover, for the first time, only Moderna's vaccine is available for children 6 months and older, while the Pfizer-BioNTech vaccine is approved for kids ages 5 and above. There's also a vaccine from Novavax approved for those aged 12 and older. Parents wishing to vaccinate otherwise healthy children may need to secure a prescription. It's important to note, as of now, no vaccines are available for infants, despite their higher vulnerability to severe cases of COVID. This is another reason why vaccination during pregnancy is reinforced. It allows mothers to pass on protective antibodies to their unborn children. Question: I've noticed some pharmacies don't have vaccines in stock. Where can I go to get one? A. While many pharmacies, doctors' offices, clinics and hospitals have begun administering this year's vaccines, some locations might still be awaiting their shipments. Vaccine manufacturers are sure that they are producing enough doses to meet demand, even with the stricter eligibility criteria. Nevertheless, some medical practitioners might choose to forego stocking the vaccine this year if they believe there will not be significant interest. This shift could mean that you will likely need to visit pharmacies to get your shot. Major pharmacy chains like CVS and Walgreens have dedicated websites where you can check vaccine availability and make appointments. Both Pfizer and Moderna have launched websites to help you locate nearby vaccination options as well. Question: even if I locate a pharmacy offering shots, will insurance cover the cost? Answer: this is still a bit uncertain. Insurance companies are obligated to cover vaccines only when they are recommended by the CDC. However, this guidance is not expected until next week at the earliest. Despite this, some insurance providers are already stating that they will cover the shots, so it may be worthwhile to inquire about your specific plan. It's important to note that roughly half of all children in the US can receive free vaccinations through the federal Vaccines for Children program. However, COVID vaccines won't be included until after CDC recommendations are finalized, and qualifications could depend on each child's health status. For individuals needing to pay out of pocket, the cost for the vaccine ranges from $150 to $200. The CDC Advisory Committee is meeting soon regarding the COVID shots. Will this lead to easier or more challenging access? And the advisory group will convene on September 18th to 19th and is expected to issue specific recommendations regarding who should receive the vaccine, pending acceptance by the CDC director. Depending on their recommendations, this could have significant implications. It could facilitate wider access by allowing pharmacists in additional states to administer the vaccines, or make them available for free under the Vaccines for Children program. However, there's also the possibility that the recommendations could lead to stricter access guidelines. Therefore, the outcome of this meeting could make the process either easier or more complicated. It all depends on what the committee decides.